Today, we will be talking about median nerve. So, let's get started on this. So, the median nerve is an important nerve of the upper limb, and so it is very essential for the proper functioning of the upper limb. And therefore, we need to know more stuff about it, and we will be doing that exactly today. So, we'll go over the origin, a little bit of the course, a little bit of the branches, supply, and also we'll talk a little bit about the cases where median nerve injury can happen. So coming to the origin and course. So if we go to the origin and course, so the median nerve arises from the medial, there you see, sorry, and the lateral cords of the brachial plexus. So it arises from C6 to T1. So there are a couple of things about median nerve that we need to understand and one of them is that the median nerve. So the median nerve, it starts in the arm, and when it starts in the arm, it's like starts from the medial and the lateral cords of the brachial plexus, and it arises from C6 to T1. So this is important for us to remember. So when I was in medical school, I used to think about stuff before remembering it to make crazy, funny, mnemonic kind of thing. So it would be easier for me to remember. And for median nerve, I had brachial plexus, mera, lala. So it's like brachial plexus, medial and lateral cords. So brachial plexus, mera, lala. C61. And when the median nerve starts and it starts descending the arm, initially it lies lateral to the brachial artery. So in the beginning, in the arm, we're just talking about arm. We're talking about the portion from here to here right now. So this is forearm. We're not talking about the forearm. So in the arm, initially the medial nerve is lateral to the brachial artery, okay? And then when it goes down, it comes a little bit medial to the brachial artery in the arm. But just before entering the arm, just before entering the forearm, it again goes lateral. So I would say that medial now has just lost like it has to make it hard for us. But yeah, that's what it does. It goes from one side to another side, and that's how it goes. In the arm, it goes from lateral to medial and then back lateral. Just before entering the forearm, so just right at this place, the median nerve again comes lateral to the brachial artery. I'm just saying this again and again because the more you hear, the more easier it's to remember. So, and here it does this between the muscles of the, here we have biceps brachii, BB, and brachialis muscle. Sorry, I don't know what's wrong with me. Here, let me fix this for you guys. Sorry. So what I was saying is that brachialis muscle. Here we go. So this is the brachialis muscle. So just before entering the forearm, somewhere here between the tendons of the biceps brachii and brachialis muscle, the median nerve again goes on the lateral side of the brachial artery. So the nerve gains access to the forearm by passing between the deep and superficial heads of the pronator teres muscle. So we know the pronator teres muscle, right? So the pronator teres muscle has two heads. It has a deep head and it has a superficial head. So in between the deep and the superficial head, the pronator teres, these two heads, the median nerve passes between these two muscles, head, deep and superficial, to enter the forearm. Okay. So after this, it travels deeper and it weaves in between the muscles and it supplies most of the muscles of the arms and the forearm and the flexor compartment of the forearm. So that's all about the origin and course of the forearm. Now coming to, just give me 1 second and get these out of the way so it's easier for you guys to understand what I'm saying. So I'm just using it as a whiteboard, okay? Yeah. So now I will be talking about the branches of the median nerve. So if we see, there are muscular branches. One, there are muscular branches. Here, you see these are the muscular branches. And then there are the sensory branches. And then we have the anterior interosseous branch. The anterior interosseous branch is also actually a muscular branch, okay? So the muscular branches, most of them arise in the arm, and they supply the flexor compartment of the forearm, and they supply the muscles of the thenar eminence, and they supply the radial to lumbrical. So if this is our hand, excuse me, my drawing is not that good, that too, especially on the computer. Oh God, it looks horrible. I know that. So just forgive me for that. So if we see, if this is the hand and this is our thumb and this is the finger, this is the little finger, okay? So let's make some a little bit like that. So this is an imaginary line that we have to draw, and we have to think about mostly this part median nerve serves and this part ulnar nerve serves. So I was in medical school, I used to think that ulnar nerve is like poor and it does not have that much power. So median nerve even takes half of this finger. At least ulnar nerve could get 2 fingers, but no, he's just getting 1.5. So this is just associating things to things, so it becomes easier to remember. And as you can see here, the radial two lumbricals. The lumbricals are usually here. So these are the lumbricals, the radial two that they supply. And the muscles of the thenar eminence. This is the thenar eminence, and these muscles are also supplied by median nerve. Okay, so this is about the muscular branches. Now coming to the sensory branches. So the sensory branches, again, I told you it's very easy to remember anatomy if we just try to do one thing that we think about the words. Like you see this palmar cutaneous branch. So the palmar cutaneous branch has a thing about it. It's palm. Cutaneous means skin, and branch means branch. If we just go with the words, we can understand that it's something that supplies the skin of the palm. And so sensory branches of the median nerve supply the skin of the palm, and they innervate the lateral aspect of the palm. Just I told you, like this imaginary line here. So this portion ulnar and this portion median. And then there is a digital. What does digital mean? It means finger, right? So digital cutaneous branch supplies the fingers. And what does it supply? The 3.5 fingers, just like this. This portion is supplied by median nerve, by the sensory branches. Now coming to the anterior interosseous branch. So it looks like a very scary name, anterior interosseous, but if you just look at it, it's interosseous. That's so because this branch it passes between the radial and the ulnar bone. You see, this is the two bones and it passes in between there. So they just kept a name to scare us off, anterior interosseous branch. So it arises in the forearm and it supplies the radial part of the flexor digitory torium profundus, so radial part. So radial part usually the median nerve supplies, and the ulnar part or the medial part is supplied by the ulnar nerve. So it supplies the radial part of the flexor digitorium, and it also supplies the pronator quadratus. So again, just to summarize, we have the branches of the median nerve and the branches, as we all see. Let me get this out of the way so I can just move forward with this presentation. So these are the branches of the median nerve that we need to remember: the muscular branches, the sensory branches, and the anterior interosseous branch. The anterior interosseous branch is again a muscular branch, and it supplies the radial part of the flexor digitorium profundus and the pronator quadratus, and the sensory branches supply the palmar area of the lateral aspect of the palm and the lateral 3.5 of those. So now we see here is the median nerve, and let me just try to make it a little bit more in from the medial and the lateral cords of the brachial plexus. And here is the median nerve. So it's going down, down, down. And when it goes down, it's lateral to the brachial artery. And then somewhere descending down, it goes medial to the brachial artery. You can't see it that good here, but that's what happens. And then it again comes lateral to the brachial artery, and it enters the arm here. Here it's entering the arm, from the arm to the forearm. Sorry, it enters the forearm. So this is the radial, this is the median nerve going into the forearm. We can also see that median nerve supplies the lateral aspect of the palm, and this portion is usually supplied by the ulnar nerve. So these are the digital sensory branches. As we can see, they supply the digits, and then there is a recurrent motor branch that again supplies muscles of the thumb. And this is the carpal tunnel. This is the area where we can get the carpal tunnel syndrome by the compression of the median nerve. And this is the anterior interosseous nerve. As I told you, this is the radius and this is the ulna. It's passing between the bones, so it's known as anterior interosseous. And I also told you that the flexor digitorum superficialis and flexor digitorum profundus, these are the muscles, digitorum profundus heads, deep and superficial head, and the median nerve passes in between these two to enter the forearm. So that's more about median now. Now going on to the next thing to understand here is that what are, like I already told you that I would give you some mnemonics, but there are not much mnemonics to remember about the median nerve. You can make your own for sure, and if you maybe I can also make some for you because I think I was okay at that. So the thing in medicine that we need to understand is that I remember our professor once told us that if you are insulted or there's something bad associated with it, you remember it more. So that's why when we're on the rounds and we're learning our professors and stuff, they usually try to like humiliate us by asking us questions, or when we do it wrong, they're like very critical of that, because when we have those negative memories, it gets stuck in our head. But I personally have found out that even having, funny memories or funny memes help you remember. So here we see it's loaf, as we all know what is loaf. It's a loaf of bread or something. So we have this loaf, okay? So these are some of the muscles that the median nerve supplies. So from L, we have the lateral two lumbricals. And I don't know why I'm struggling here, but I'm just trying to get a good presentation. Sorry again, here. Okay, so lateral two lumbricals, then the O is the opponens pollicis, and the A is the abductor pollicis brevis, and F is the flexor pollicis brevis. So lateral umbilicals, opponens pollicis, abductor pollicis brevis, and the flexor pollicis brevis. So this is the muscles that the median nerve supplies. There are some of, they're not all. And then there is this beautiful thing that is doctricuma. So the doctricuma helps us remember the injury. There is funny mnemonics. So D is for drop. So we see a wrist drop in injury of radial nerve. Then C is for claw hand, and we see the claw hand in the injury of the ulnar nerve. And then M is for median nerve, and we see the ape hand in the injury of the median nerve. So yeah, that is there. And then we have, yeah, so that's the loaf and the doctricuma thing that we have. So now I'll tell a little bit about the injuries that can occur that are related to median nerves. They do ask them sometimes in questions, and being a doctor, we should know those as well. So the first thing is the carpal tunnel syndrome. As we all know, it's very famous. It's usually the most common median nerve injury, and it occurs due to compression of the median nerve in the wrist. Like here we see the wrist, the compression here, the median nerve compression in the wrist causes the carpal tunnel syndrome. The symptoms usually will include pain, numbness, and tingling in the thumb, index, and middle fingers. So it's but obvious that those are the areas that the median nerve supplies. So those are the areas that will have, so when it's compressed here, and then we'll have the effects in, I'm sorry, mostly in this part. So this is the part where mostly there will be the effects of the median nerve. There will be pain, numbness, tingling sensation in the thumb, index, and the middle finger, and some part of this finger as well. So the other deformity that is there is the pronator syndrome, and it occurs when the compression of the median nerve in the arm. So when it's compressed in the arm, so near the elbow or forearm, wherever it is, it leads to pain and tenderness in the forearm muscles, because the muscular branches are coming out there and they supply the forearm of the muscle, and that's why you'll have pain and numbness or tingling sensation in the forearm. And sometimes it can also lead to the weakness of the hand, because like if it is affecting here, so the problem is here, so everything down there can be affected. But when it's affecting here, problem is here and nothing here gets affected. So that's the difference between both of them. And then we come to the anterior interosseous syndrome. It occurs due to the affection of the anterior interosseous nerve, and it leads to the weakness in the flexion of the thumb and the index finger. So the thumb and index finger, they should be able to we should be able to get them together, the thumb and the index finger. But like this is the thumb and this is the index finger. So the OK sign that we made, the OK sign is because of this. Now that we can make that OK sign, so leading to weakness in the flexion of those muscles, and that causes that problem. Now the common side of the sign of median nerve injuries, of course, they include pain, weakness, numbness in the hand, wrist, or forearm, and a burning sensation in the lower part of the arm. And the other thing that is very commonly associated with median nerve injury is there is a difficulty in there's a difficulty in using the hand to grab items or perform fine motor tasks, because the thenar eminence and the opponent's brevis and all those muscles are supplied by median nerve. So that's all for now. Thank you, and I would appreciate if you like and subscribe. And if there is any topic that you want to learn more about, just let me know, and I will make a video on it. Thank you.